Hi, and welcome to this Friday's 5-minute consult with your favorite family medicine doc. In these videos, I discuss everything that you need to know on some of the most common health conditions listed from A to Z in 5 minutes or less. And today's topic starts with the letter E. So let's talk about earwax buildup. What is it? Well, first of all, what is earwax and what is the purpose of it? Earwax is a substance that's produced inside your ear canal, and although we don't know exactly why we have it, it is thought to help prevent some dust and small particles from entering into the ear and damaging or disrupting the eardrum. Everyone makes earwax, but some people make more than others, and it is determined genetically. Earwax dries up and removes itself on its own, but for some people, they experience an earwax buildup or earwax impaction. This may be the case for people who naturally produce more earwax or who may have smaller ear canals where the earwax is not easily removed. What are the symptoms? Symptoms of an earwax impaction typically include a plugged or fullness sensation within your ears, ringing in your ears, ear pain, dizziness, or even decreased hearing. Some serious symptoms of an earwax impaction could indicate that you have an infection that has developed, and those include itching of your ear, fever, serious pain within your ear, or odor or drainage from the ear canal. When should you see your doctor? If you are experiencing any of the symptoms previously listed, this may be an earwax impaction. However, if you are experiencing similar symptoms but they are more severe, such as a severe spinning sensation, loss of balance or the inability to walk, persistent vomiting and high fever, or sudden hearing loss, then that could indicate that you are having a more serious condition, in which case you would want to go to the hospital. What are the causes? Earwax impaction is caused by anything that pushes the earwax further inside the ear canal, so this can include using things like hearing aids, earbuds for listening to music, earplugs, or the use of cotton swabs to help clean out your ears. Some people don't realize that in an attempt to clean their ears, they're actually pushing the earwax further into the ear canal. Diagnosis. Diagnosis of an earwax impaction is fairly easy. Your doctor is going to listen to your symptoms, and once they look inside your ear with an instrument called an otoscope, they will be able to see right away if you have an earwax impaction or not. They will be able to tell because when they look, they will be able to see that the earwax is completely covering your eardrum. What is the treatment? The treatment of an earwax impaction can depend on the severity of the impaction as well as the quality and consistency of the earwax that is built up. If the earwax looks very hard or dried up, your doctor may use a small drop of an oil solution inside your ear canal. This will help to soften the earwax before they try to remove it. Once the earwax is softened up a bit, they will mix a solution of warm water and sodium bicarbonate or peroxide. They usually put it in a spray bottle that has a funneled or small narrow tip at the end that they can then put in your ear and help spray to remove some of the earwax. Sometimes when the ears are being sprayed, some patients can feel slight discomfort or even a feeling of dizziness, but this should not be severe and it should not last after the flushing is complete. For any earwax that is being stubborn or is not completely removed with the water flushing alone, then your doctor can take something called a curette, which is a small tool that they will use to help scrape out some of the rest of your earwax. Again, this is a very common condition. Working in urgent care where I see up to 20 to 30 patients per day, I would have at least 2 to 3 patients per day come in for earwax buildup removal. This is the treatment that is used in the clinic, and if you are one who knows you have issues with earwax buildup, you may know that you need to come to the clinic every so often, for instance, such as every 6 weeks or every 6 months to help remove your earwax. If you know that you have trouble with earwax buildup, but you know that it doesn't necessarily lead to a severe impaction, then you may be able to get by with treating your earwax at home. There are certain drops that you can buy over the counter to help soften earwax, and one of those is called Debrox. For patients with earwax issues, it may be recommended for them to use that at least daily or even every other day. Other home treatments that can help soften earwax include mineral oil, baby oil, or glycerin oil. After you have tried some of these earwax softeners for a few days, then you may be able to use a bulb syringe to try to flush out some of the earwax yourself with warm water. They do make some ear flushing kits that you can buy over the counter and try at home. But if for whatever reason it's not working or you feel like you still have earwax buildup, then you'll want to see your doctor for the clinic treatment. If you have heard of ear candling or have considered trying it, just to let you know, as doctors, we don't really recommend it because there is not a lot of studies out there that show it works very effectively and it can be kind of dangerous. Earwax buildup complications. As we talked about, in some cases of an earwax impaction, it can be severe enough to lead to certain complications. These complications can include an external ear infection, which is an infection of the ear canals, a middle ear infection, which is an infection of the eardrum, or even a perforated eardrum. And sometimes even permanent hearing loss could be a result of some of these complications if they are severe enough. Now let's talk about prevention. Like we talked about, if you are one who knows you suffer from an increased earwax buildup, then you want to avoid using any Q-tips or basically anything that is entering into your ear that would help push back the earwax and lead to an impaction. But if you are not one who deals with an increased amount of earwax or earwax buildup, then you could get by with using Q-tips. You just have to know for yourself. Overall, no matter what type of earwax person you are, to avoid excess discomfort or issues with your hearing, try and keep those ears squeaky clean. And that wraps up our discussion today on earwax buildup and impaction. I hope that it was helpful for you. If you would like to see more educational videos like these on some of the most common health conditions listed from A to Z, be sure to subscribe as I am making new videos every Friday. And I'll see you on the next video. Until next time, bye!